So this is our group therapy for families dealing with others in substance abuse disorder. This is a discussion of the introductory therapy session utilizing the stress strain coping support model with Lauren Baker, Mariana Guzman-Pena, and Jessica Dorsey. So in preparation for the first module meeting, we'll have the leader and the co-leader get together and discuss the structure of the meeting, who will talk about what each person's role is once the meeting has started, just so we are on the same page and we know what discussion topics each is taking authority over. We'll do a pre-screening in which we'll make sure that interviews take place so we know which common issues each family is facing. And that'll also give us a resource to be able to track the progress of each family and see the success of our group training or our group therapy. We'll finalize logistics about the event and share information with participants 3 months out from the training, 2 months, 1 month, a week, and a day before the first session, just so they feel involved all the way up until the first session and they don't feel like, anything will go on before they're aware. We'll have a check-in process. We want to make sure that every meeting is documented for research purposes, again, for us to track progress. We'll have participants sign in and sit by their family unit. We'll make sure there are name tags, pens, and booklets available, and we'll also set up in a circle meeting circumstance so that everyone feels equal in their sharing opportunities and no one's kind of behind or in front of anyone, and everyone feels that equal and comfortable.
So after we begin the check-in process, we'll begin to then start a small icebreaker. Now, I feel like we've all been in experiences where an icebreaker was really, really good or it was really, really bad and awkward. So the co-leader and the leader will come together and discuss prior to the initial meeting about what icebreaker they want to do for the therapy session. Now, whether the group is a little bit tense or they might not be willing to talk as much, the co-leader and the leader will have discretion on whether or not they want to continue on with the icebreaker, but we definitely want to make our families feel welcome and kind of loosen up the room a little bit. The next thing after we present our small icebreaker, we want to talk about some ground rules. We want to go over these rules and then allow our participants to come up with 3 rules as a unit to kind of dictate on how exactly we want to run things inside of this group. And so the 3 things that we really want to emphasize before we give them the choice to give us their 3 rules. We want to advocate for respect. We want to advocate for effective communication, as in just listening first and trying to seek understanding, and then talking second and sharing our opinions. And then also having a clear line of just learning how to stop when tension does arise. We just essentially want to emphasize the importance of honesty and a judgment-free environment. After we present the rules, we also want to explain confidentiality in and of itself. I think it's important as social workers to help members and clients understand the process of trust. And there comes a time as professionals that we do have to break confidentiality just so that we can keep everyone safe, keep our clients safe, and keep the surrounding people that surround our clients safe as well. This is something very, very important we do not take lightly. So we would love for all of them to sign a form.
All right. And then once we've gone over the logistics and setting up the group process, we will introduce the members to the 5-step model, the stress strain coping support model that we've chosen, which really takes a strengths-based approach because it's not looking at the family as the problem. It's really looking at drawing on their strengths, but identifying that the family experiences stress and strain because of the substance use disorder experienced by their loved one or family member. And then that also impacts how they cope and also whether they access social support for their family. And then on the next slide, what we will look at is basically we want them to be able to share their thoughts. We want to have conversation happen. Step 1 in the stress strain coping support model is for them to share their situation, for them to really explain what's going on in their families, and hopefully get them invested into the group so that they will come back for further sessions, and into also to instill some optimism, which you can see in the next slide is there are laid out pieces of each step, so that and pretty much things to achieve for the group process in this model. And then after that, we will discuss the next session, have them prepared, and then we will say our goodbyes until we see them again.
So thank you guys so much for listening, and let us know if you guys have any feedback. Thanks.
Thank you.